folks, welcome back. Welcome back. You ever thought about when you drive a state car and you park it outside a casino? And then you back up into the governor's vehicle and do some damage. You ever thought, I wonder what's going to happen now? You know? Well, we're here to find out. This is the Department of Risk Management. Okay, they have the insurance program and stuff where it covers, and it gives me a comfortable feeling to know that they are behind us as long as we are acting within the scope of our job. Within the scope of our job. And we're going to start out with Janet Ingalls. She's going to have a presentation. And then we're going to hear from Nalia Longtree. So it's three people in the program. And then we talked some about the Employee Assistance Program yesterday. And we have the person who's running the program with us as the third of the three speakers for this portion of the program, Quotation Hunt, who's going to talk about the Employee Assistance Program. So let's make welcome the representatives from Risk Management Division of the Finance Department.
It's good to see all you here today, even though we all look like bandits most of the time. But anyway, as Stace said, I'm here from the Department of Risk Management. I actually work for the Department of Finance and the Public Information Public Information Officer, and I'm just here to give you kind of an overview of the General Liability Trust Fund and the Auto Liability Trust Fund. So we'll get started. The Division of Risk Management has the funds that are listed up here. Again, I'm going to hit the first two. Then Melanie's going to talk about the State Employee Injury Compensation Trust Fund, and Quotation's going to talk about the Employee Assistance Program. So, as Stace said, what would you do if you were sued as a state employee, or if you were driving a state vehicle and were involved in an accident? And yes, this does happen. Let's talk about liability first, and that's the lawsuit part. The GLTF is a fringe benefit for state employees, which is a set of written guidelines similar to an insurance policy, and it outlines the condition of your coverage. We cite the code section up here, 36661, the Code of Alabama. If you want to go look at it, take a peek. It's thrilling to read. Covered employees include state employees and agents of the state acting in the line and scope of their job requirements. This includes full and part-time employees of the state, contract employees but not contractors, elected officials, foster parents licensed through DHR, and adult foster care. If you have a question as to whether you fall into one of these categories, your personnel supervisor at the office can tell you. Probably most people in here, I think, fall into that category, into one of those categories. But again, you can ask them, and if they can't tell you, please give us a call. Our number's on the sheet that you have in front of you, and we'll clarify that for you. Sorry. So if you're served with a lawsuit, fairly simple, you will immediately forward the original suit to your director and your department. Not the whole department. The director then forwards a copy of the suit papers and other information to our office and to the Attorney General's office. That is because we provide the Attorney General's office, we go through them, and they provide your defense. So that's, very important to do, to come to our office and then the Attorney General's office. But your director will help you through this process, and so will we. Remember, we're always here to help. That's the number one thing we want you to know, is that we're here to help. So, does anyone have any questions about general liability? Okay, so I'll move on to auto liability. So, auto liability is an extension of the GLTF. It provides liability protection for state employees while operating vehicles licensed for road use, again, in the line and scope of your job duties. And like they said, you can't be at the casino, backing into somebody's car, using it in a way, taking it Sally to the beauty shop or whatever. Yeah, you just got to be doing your job. So it provides $1 million of coverage combined single limit for both bodily injury and property damage per occurrence. Coverage applies when a state employee is driving a state-owned vehicle, and that means that it's okay for non-state-owned vehicles. Employees are protected while using them most of the time, but talk with your fleet manager to make sure. In almost every case, that's probably the case. You're probably covered. But always talk to your fleet manager first. Any insurance on the personal vehicle is primary to the state's coverage. So if it's your own vehicle and you have one of the big insurance companies, Geico, something like that, Aflac, if you have one of those insurance companies, that coverage will come in first, and the state will fill in after that coverage is used. It requires that you purchase liability insurance, which it complies with the law. Alabama law is that we have to have liability insurance. For rental cars, covered employees are protected while using rental cars on state business. And that's another big one. Just check with your fleet manager, and they'll make sure and tell you whether you're covered or not. It's occasional, but I don't want to rule that out completely that it's possibly not covered. So always talk with your fleet manager. So if an accident happens, automatically report any accident that involves damage to a state vehicle. Our office number is listed there. It's also on the sheet in front of you. And if the accident occurs after hours and is serious in nature, call the 800 number on there too for immediate assistance. We've included that. And we've also included our riskmanagement.alabama.gov email address on there. In most state vehicles, I'm pretty sure almost every one of them, but there is the random case. There's a green packet, a green envelope with the information on it and forms to be filled out. The information has the phone numbers on there, so if you are in a state vehicle and you have an accident, it's right there with you. So that brings me to the end of that presentation. Does anyone have any questions on that part? Oh, I'm sorry, I thought you were. So I will bring up Melanie Longfree, and she'll talk about the State Employee Injury Compensation Trust Fund.
All right, can everybody hear me okay in this room? I think I talked loud enough about I figure we don't need to be sharing microphones. Just be on the safe side. Not that I don't trust Jana, but as Jana said, I'm the program manager. We like to call it the SEICTF program because State Employee Injury Compensation Trust Fund is a big mouthful. Or you might hear us say employee injury. So my goal here today is just to give you a little information in case you were to have a work injury. I hope that never happens, but just to give you a little information. You should all have, and if not, I put some at the back. It says Guides to Benefits and Claims Filing. This kind of will tell you everything that I went over today. So if you forget something, hold on to this, and it's a good reference tool. And if you lose it, our website has the same information on there. All right, so our program was actually set up by legislature, and this was to cover you as state employees in case you have a work injury. With any of our programs, the main biggie is that you're in the line and scope of your job, that you're doing what you're supposed to do when the injury happened. We do cover all full-time employees, most part-time employees. It really just depends on what the agency decides. We kind of leave that up to them. And the employee, if you're part-time, I don't know if I have any part-time people, you kind of have to have a set amount of hours, not just get called in here and there to be covered. So with part of our program, the main benefit is you pay out of pocket. You should not have to pay any co-pays, any medical expenses, you go to the pharmacy to get your medicine, any of that, you should be covered. Sometimes it happens day one because we don't have all your information. You might have to, but we'll get you reimbursed. Blue Cross is our carrier, so it's easy to get them. You're already in their system most of the time, and they'll cut you a check is how we do it a lot of the times. All right, so the injury happens. What should you do? Report it. Right, report it. Go ahead and tell your supervisor immediately. You may think this is silly, I'm fine, you stepped in a hole, twisted your knee, my knee's fine. But it continues to hurt, so go ahead and do that because we do have a reporting deadline. We like for them to be here within 24 hours, but our rules say that it has to be 5 days. And that's not necessarily to us because we get a lot of injury reports way after the fact, but you have to let that supervisor know by day 5 to be covered. So your injury happens. We have a list on our website of what we call gatekeepers. These are just our frontline doctors. They're in most counties, some they're not, if it's just because there are parts of Alabama that are very rural and we cannot find doctors that are willing because they already have such a huge caseload. If that's the case, you can go to the emergency room or you can go to one of the adjacent counties if you do get injured. And you don't have to either. You can report your injury. If you don't feel like you need treatment, you can wait. We'll talk to you, explain, what's going on, and then you can go if you want to after the fact. There are 2 forms that we're going to need. One's called the first report of injury. Your supervisor is going to fill that out. And the other one is called the accident report employee statement. Basically, it's your statement of what happened. And I'm going to show you those forms in just a moment. I'm going to go back over that last one. Let's skip through this one. Here we go. So this is what the first report of injury looks like. It's basically just going to give your name, your date of birth, where you live, because we're going to be mailing you things. It does have your social security number on there. Everybody's a little leery. A lot of times we get it in with the last 4. Well, we can't put you in that way. That is actually how the providers are going to bill to Blue Cross. They use a different prefix than our EIB number. So they're going to use a WRI and your social. So that's how the doctors are going to bill. And if Blue Cross has nothing, it won't get paid. So that's why we need that. I've been here. This is my 20th year so far. Fingers crossed, I don't want to jinx this, but we've never had any issues. We've never had anything go on with anybody's social. So I feel like it's really safe. On here too, your supervisor is going to fill out the date it happened, the time, when you notify them. So that's why it's important to go ahead and tell them. And they're supposed to give us all the details of the accident. We don't always get a ton of information sometimes. So sometimes we have to put it under review because we're not sure why you're out on the road. Did you go to lunch or were you really doing something work related? So really important, if I have any supervisors in the room, just be real detailed when you fill this out so we know what's going on. All right, so this is the form you're going to fill out. Pretty much mimics the first form. Just be sure again, give us lots of details about what happened, what's hurting right now. It could be you've been in a car wreck, you may be hurting all over, and that's fine. Just tell us that so we know. And then at the bottom, it asks just a few extra questions than it does the supervisor. It wants to know if you've ever injured that body part before. We ask this because a lot of times we have people that might have chronic back pain. Well, if you injured your back, we kind of need to know what we can do because our job is to get you back to how you were when you had the injury. So unfortunately, on those cases, we can't ever make you pain-free. Wish we could because back pain is not fun. But then you'll sign this form and your supervisor at the bottom. All right. This is the form when you first go for treatment. If you're in the office, please take this with you if you can. Your supervisor can give it to you. It's really just going to give our doctor authorization to treat you. And when you go to the pharmacy, there's actually page 2. I didn't print the back side of it, but it gives them the billing instructions. So it's really good to take because when you go to the pharmacy, if they can't get it to run through, they'll call us. If it's during 8 to 5 work hours, we're there and we can get everything to go through. Same thing with the doctor's offices. Most of our offices are going to see you because they have this form, and then later if they're having trouble, they'll call us. So this is really just your supervisor is going to fill it out. Again, tell the doctor what happened. The doctor here is going to give us a diagnosis, and can you get back to work? That's going to be really important. Can you get back full duty? Do you maybe need to be on some restrictions for a while? Or if you're in a car wreck, maybe you need to be out for a couple of days so you can recover. So this is really important to pay attention to, and this is just not for work. We actually, at the very bottom, added a little thing for the employees to sign saying it's 24 hours a day. We were finding employees, they would say, well, I picked up my child and I hurt my back again. And they'd say, well, how much does your child weigh? 40 pounds. Okay, well, you're on a 10-pound lifting restriction. And they just weren't, they were just thinking it's at work, not at home. So I say that just to remember, that it's for both. And it's really important to take this back to your supervisor because they're going to need to let you know can you come back to work right now? Do I have something you can do? And most of us, I work in an office, so I can do most anything of my job, even if I'm on restrictions. But if you work outside, you're doing heavy lifting all day, you might not be able to. All right, so you reported your injury, you've sought treatment. Now what can you expect from our program? I always like to say we have 28 lovely ladies that I work with, and one of them will call you. They're going to call, and really their job is just to confirm what happened. What happened, where were you, what's hurting. That way we've got it all documented, because as I mentioned, sometimes we get the first report of injury, it says back pain. But then when we talk to you, find out you're in a car wreck, your neck's hurting too, your right shoulder is hurting. So we like to get everything documented in the beginning. So please definitely call us. We also send out an initial letter, 7 pages worth. It's really important though, because it gives you all the information. In that letter, anything that might happen. In that letter, it's going to be a medical release, and we need you to sign that and give it back to us so we can get your records, so we can kind of monitor your treatment and make sure everything's going okay. We do have case managers, nurses in our office, and you probably would never talk to them unless you need surgery or you've been in a traumatic injury. But our nurses, if you had shoulder surgery, they're going to follow you, make sure therapy's going good, that it gets set up for you, whatever you might need, they're kind of there to help coordinate treatment. The letter also talks about mileage reimbursement. If you live in a rural area and you get referred to a specialist, chances are there's not going to be one right there. You might have to drive into Montgomery. So we cover anything 50 miles round trip, and we pay you at whatever the current state rate is. All the forms that I talked about today are on our website, which is on this form I gave you, the website is. I always like to repeat the 5-day rule. Please make sure you get your injuries reported, because we don't want to have to deny it for that reason alone. Just really briefly, be compliant. If the doctor wants you to get a therapy, attend therapy. And I know right now there are other options because people are very concerned with COVID. So therapists can actually do virtual visits. They can walk you through it. So there are those options if you're uncomfortable in the office. Just let us know. Don't just not show up, because we'll start sending letters saying we're concerned. We'll send a non-compliance letter. If you don't call us, we don't hear from you, then you get a suspension letter and then a determination. Because we're here to help, but it's your job too to participate to get well. I mean, that's our goal. We want you to get well, you want to get well and get back to work. So really important. And I will say, when we're trying to reach you, please call us back. We terminate more people every day just for not calling us to tell us about their injury. And we try this for months. It's not like we just try a couple of times. We call, we send letters, and then we terminate them because they never call us. So really important. Don't be that person. That's not why you want to lose your benefits. We do cover, I'm assuming most of you, if you're in this class, you're new employees. We do cover if you don't have a lot of annual or sick leave, and you have to be out of work, if you have to have surgery, we are going to cover you. It's called 2/3 pay is what we call it. It's not taxed. We can't take all your extras out of your check, so you will be responsible for that part. And we actually mail our checks, which is a little different. We're used to getting direct deposit. But we mail them out 2 days ahead of time, so sometimes you get them the day before everybody else, just depending on how the mail runs. So, but we do cover you during that time. Your first 3 days are your own time. But if you have to have that surgery and you're out for 21 days, we go back. We can't give you those 3 days back, but we'll pay you for them. So that's our way to compensate you for that. The form that you'll need to fill out is called an election of benefit form, and I'll show that to you in a minute. But if you're going to lose time, you'll need to fill that out and get your supervisor to sign that. Do I have supervisors in here today? Any new supervisors? Yeah, okay. There is, just to let you know, there's a deadline every month. There's 2 deadlines for payroll, and it's by the GHRS calendar, and it'll tell you on there, SEICTF deadline at noon. So really important, if you have an employee that's hurt, let us know their hours, because that's how we know how much time they're out of work. And it could be, it doesn't have to be like, I'm out a week. It could be 2 hours of therapy, 2 hours for the doctor, whatever adds up to 24 hours. That's the key, that you need to fill out the election benefit form. And this is what it looks like. We've got all kinds of options because we've got tier 1, tier 2, law enforcement, all different kinds of options on here. But let us know too, even if you lose more than 24 hours, but you're using your own time, we will report that to comptroller's office at the end of the year. So just say you use whatever, you end up using 3 months worth of your leave, what we'll do is we'll report that. That way you're not taxed at the end of the year for that time that you took of your own. That's one benefit of just taking your own time, if you have it, because everything keeps going with your benefits. You don't have to worry about paying insurance or whatever it might be that you have coming out of your check out of pocket. With anything in life, communication's the key. Yes, ma'am.
Yes, and I'm sorry, I was just waiting to see if you were going to cover that form that you had that said employer's first report of injury or occupational disease. What is an occupational disease?
I will.
Okay.
So the form, the very first form that I talked about that the supervisor fills out, that's the first report of injury.
Okay.
I can go back to it so you can, I think.
The piece that said occupational disease?
I will. I'll talk
Okay.
about that part. I'll
Okay.
explain that more. But were you wanting to see the form?
No, I just wondered
Just
what
want to
is
understand what occupational disease.
What occupational diseases? Okay, I can definitely talk about that. And there's more. Let's see. Let me get back to where we were. Sorry. A work injury does not always mean that you had just a physical injury to your body. We have correctional officers, troopers, mental health workers that get exposed to blood a lot of times. So that's what we consider an occupational exposure. It can be a needle stick. Unfortunately, at the prisons, lots of things get thrown on them. So that we send them in. We send them in for testing. If that happens, we do baseline testing and then testing at 6 months. We're going to test to make sure that that employee didn't acquire HIV, Hep B, Hep C through that exposure. And there's also, you could have like a chemical exposure, which would also be occupational. It could be a fire, you inhale those fumes, that could be an exposure. We call those inhalation. And right now with COVID, we have over 400 COVID claims right now that we're working in our office. And that's just from all different agencies. Mental health is a big thing because most of the hospitals, it's kind of coming in through employees. And they're exposing the patients, so then they're taking care of patients and they're acquiring it themselves. So we've had a lot of positive cases, thank goodness, a lot of negative cases, but that would be another example. It could be, I don't know if I have anybody that works outside. We cover you if you've been exposed to poison ivy. If you get a tick on you, same thing. Let us know, report it, because we like to track those because we do the testing to make sure you don't come down with Lyme's disease. Trying to think of any other. I think that's most of them that we have.
Thank you.
You're welcome. All right. If you have an employee that was involved in a serious injury, you know, they're being transported by ambulance to the ER, let us know. We have nurses out in the field that can go in and check on them, just kind of talk to the family. Right now, we're a little limited because we're not in, they won't allow anybody in the hospital except for that injured person. Even family can't go in with them right now. But we will, that's our norm, is that we send somebody in to talk to the family, let them know we're here. This is not your expense. That way we're there if they need to be transferred to a rehab hospital. We do ramps in people's homes if they need it, just really depending on the injury. So please let us know. We like to get involved on those on the front end. That way billing issues don't happen, because we see when we find out weeks later, the hospitals just bill in your group health. And it seems like it takes forever to get everybody on board and billing the right way afterwards. If a pharmacy or provider charges you and you can't, it's after hours, let us know. We'll get it all straight, like I mentioned earlier. If you have a change of address, really important. We use the STAR system, so if we're trying to pay you, it doesn't match. That's really, really important. So make sure also that your name and your address are just like it is on your paycheck, really important, so that we don't have any problems paying you. Just briefly want to mention red flags. If you know something didn't happen at work and somebody's reporting it, let us know. I give this example just because it's easy and kind of fun every time, but we had a DOT employee report a knee injury, said it happened on Friday, reported it on Monday, which was in our reporting time frame, so we didn't question it. But an employee went to the supervisor and said, that didn't happen at work. I watched him this weekend slide into third base at a softball game and injure that knee. So it doesn't happen often, but if you know something like that, let us know. We're not going to call you out and say, oh, by the way, Tom called to let us know this. We're just going to investigate further, get more information on it. All right. Any questions on employee injury? All right. I'll take care. Have a good afternoon.
There you go. Under that mask. Okay, so we're going to talk about that's what the heat will do for you. Okay. All right, so we're going to talk about the State Employee Assistance Program. I understand that there were a few questions that happened early on, so this will be a great opportunity to kind of rethink what you all were kind of discussing early on and present those questions. I'll be more than happy to answer what I can for you, and what I cannot answer, I will, today, I will get that answer for you a little bit later on. I'm Caucasian Hunt. I've only been with the state just shy over 2 years, and I've just really enjoyed learning how the state operates. I come from a nonprofit background, so this is totally different. So our Employee Assistance Program.
Try the microphone.
Oh, I'm fine. Yeah, I'm
A
fine.
little more zip.
Can you all hear me okay?
Can now.
Y'all can hear me? Oh, okay, you can hear me over here. Typically, well, I am a singer, so I can't get very loud. No, I'm going. Seriously, I'm like for real. Y'all think I'm kidding?
Yeah.
Look me up. No, I'm joking. All right, so our Employee Assistance Program is a program. It is a professional program, and we offer confidential assessments and referrals. We also offer short-term counseling, community resources referrals, and community directories. And we also offer regional training sessions. We get a few calls, and they often ask, will my manager or supervisor find out that I'm taking or I'm using the EAP? No. If it is a self-referral, they won't have to know. Now, we're going to talk a little bit about self-referrals as well as supervisory referrals. And I understand we have one supervisor here in our midst. But also, the only way that your employer will know that you are accessing EAP is if they write a supervisory referral, or if you just tell them. Otherwise, we take pride in the confidentiality. And the only way that outside of your therapist, the only way that your employer or anyone above will find out about anything that is going on is if you threaten to harm yourself or harm someone else. And I've shared this story. Stacy's heard this story before. We had a DOC employee that said he wanted to kill his fellow employees, his colleagues. And then he made the comment that he wanted to slit his mother's throat and paint his apartment in her blood. Well, that's something that the supervisor is going to find out. They immediately took him off of work and wanted us to go a little bit further than what the scope of practice allows. And so unfortunately, our therapists were not able to treat him because he had had a previous diagnosis. Now, this does not, prevent anyone from getting help because they had a previous diagnosis, but his diagnosis was a little bit beyond the scope of what those therapists could offer. So, but as far as confidentiality, we do pride ourselves on that. Short-term counseling,
community resource referral on our website. Oftentimes, our contracted agency, Behavioral Health Systems, Inc., which is in Birmingham, oftentimes they have national resources. That's good, that's fine. But we're in Montgomery, we're in Alabama, some of us are in rural areas, and we need resources in our areas. Because over in DC, we can't just hop on a plane all willy-nilly and go and say, hey, I need some of your resources. So you can access our website at riskmgt.alabama.gov and find a community resource directory. And we're constantly updating that directory, and hopefully, well, eventually it will include all 67 counties with those different referrals. Our regional training sessions, we have training sessions quarterly that begin in February, April, and then again in June. Those training sessions are free. And the training sessions cover just a spectrum of different topics, from behavioral health to those who may be in human resources, public health. We just cover a number of different topics. All right, so the employee, and also, like I said, it's free, and we offer continuing education hours for those, any social workers in here, or nurses, or, okay, I see some hand in the back. So you get free CEUs for nurses, social workers, and accountants. Any accountants that are here? Okay, we have 2 accountants. Okay. I've just recently wrote an application for our office to become a CE provider for social work, so that way we don't necessarily have to depend on our contracted agency when we actually go out and do additional trainings. So your benefits include a total of 3 free counseling sessions each year, and unfortunately it's not a rolling year. You have to use those sessions within our fiscal year, beginning October 1 to end September 30th. It's available for all participating agencies. Unfortunately, not all agencies within the state participate in this because it is not mandatory. So, but most of the state agencies do participate. So if you're concerned whether or not your agency participates, you can always give us a call, or you can just ask your personnel director or your supervisor to find out. Of course, our services can be used for assessments and counseling for individual and family issues. So you can use your 3 free sessions to go in as a family. Or if mom and daughter are having issues, you two can go. If dad and son are having issues, if everybody's having issues, everybody can go and utilize those 3 free sessions, and they're really good. Yeah, family group sessions, counseling sessions are available. All right. Any questions so far? No. Okay, these, although this is a nice list, it is not an exhaustive list of services that are available, but some of the assistance that we offer are marital and family, financial management, job and personal stress management. How many of you are going to be working from home? No one? No one? Oh, just a couple of people working from home. What we've noticed, Stace, some of the calls that we're getting in, people are stressed out from working from home. They're stressed out working from home. And so I noticed that your face, like, who wants to be stressed out working at home?
Hey, that's a blessing.
That's a blessing, yes. But if you're at home and you're having marital and family issues, that's a whole nother situation. Yeah, it's hard. If you're at home and you're trying to work and you have more month than you have money, that's a whole nother level. So we're getting more and more calls in the office or to our contracted agency saying, hey, I am stressed out at home. I need to be in somebody's office so that for just a little while, for just a few minutes, just a few hours, I can come away from the financial issues and the burdens that I'm having, and my kids are running around and I can't get anything done, and my husband is hitting me and I'm scared. They're stressed out. But the employee assistants, oh God, I feel like I'm about to preach in here. I had to bring myself back in. Reel it in. All right, reel it back in. So you have all of these people that are calling our contracted agency, I've only gotten a few calls in my office, but we have people that are calling our contracted agency that need to be back in an office setting or an office environment because they have these issues going on. It looks simple on the screen, but when you have a spouse or a significant other that has lost their entire income due to COVID, and now you all just built a house, just got a brand new car, and you're on one income, and then the additional $600 for unemployment is running out at the end of the month, and your child now has to go to school virtually. You don't have anybody. What are you gonna do? Who are you gonna talk to? We have to have a sounding board, and our sounding board for state employees is the Employee Assistance Program. It is a great program. So depression and anxiety, that has been at the height. Depression and anxiety. We have people that are calling us that are saying, I'm afraid to be in the office because I see people not wearing masks. Or someone came out the bathroom, flushed the toilet, and I didn't hear the sink come on. These are like legitimate issues that people are calling with. They're afraid to be at home because they may be in an abusive environment, or they want to get away from the issues that are going on at home. They're afraid to be in the office because they see these other things that are going on. So how do they balance? There's an imbalance here. ADD, ADHD, substance abuse, work-related problems. I think we can all talk about work-related problems. So-and-so said this about me, or they didn't take me to lunch when the other group went to lunch. So there are a whole lot of issues. Yeah, I mean, we get that. Yeah, like seriously, like, oh, so y'all going to lunch? Y'all could have asked me. So there are a lot of issues that actually go on that people need assistance with. Even though we have this list, this is not an exhaustive list. They can tailor your therapy sessions to what you're going through, only within the scope of their practice and the scope of the contractual agreement that we do have with our contracted agency. All right? Any questions about it? All right. I know it's after lunch. I'm almost done. I promise you. Hold on just a little while longer. I know. I feel you. I'm always the last one to go, so it's like, all right. Okay. Some of the advantages that we have with the Employee Assistance Program is that we have a nationwide provider network. Over 10,000 therapists throughout the U.S. Anyone have any children in college? A few hands, a couple of hands. Okay. All right. So if you have a son or daughter that may be away in college in California, they are struggling, they don't want to talk to the counselor there on campus because they're having trust issues, we can have a counselor there to meet with your son or daughter within a matter of hours. And this does not cost you anything. Your employer pays a $9 fee for you to access, so that it doesn't cost you anything out of pocket. So if you have a son or daughter that's away at college, they're your dependent son or daughter, they need a counselor, we can make it available. If you're on vacation, I love to share this. If you're down in Florida enjoying Mickey and Minnie and as a family, and then all of a sudden everything goes left and you need a counselor and you haven't utilized your 3 free sessions, we can have a counselor there available to you, to talk to you, to navigate, because you got 8 more days on your vacation. And you mean to tell me I got to spend 8 more days with this? Well, we can have a counselor readily available to you. That is the benefit of having a nationwide network. All right? Therapists all over. All right? We have dedicated care coordinators that are available to take your call. The routine appointments are scheduled within 3 days, 3 business days. Since I've been here and I haven't heard any other story, there's only been one time that it went outside of 3 days, and that was because the individual, she was just not willing to share information. She was a new employee. They had not gotten her some information in the system when she tried to access us. And she didn't want it. And so it took 10 days. And she did not get the services that she deserved and needed. And I take that to heart because we have a 3-day turnaround. All right? So they also offer face-to-face assessments. The only time you'll do a phone call is during your initial consultation with the care coordinator. And they're available, behavioral health systems, their office is available 24 hours, 7 days a week that you can talk with someone. But the counselors, their main office is only, I think, like 7 until 5:30 or 7:30 to 5. We offer online work-life resources. This is available on the website. Everyone should have one of these at your desk in front of you. If you do not have it, I'll be more than happy to give one to you. This password, DORM, stands for Division of Risk Management. Once you go on Behavioral Health Systems website and you access their membership tab, they're going to ask you for a password, and that's the password that you would put in. And then that gives you, it opens you up to just a portal of just great information. If you're taking care of an elderly parent and you want to know, get information about elder care or what have you, it's there. It's almost like a concierge service. You're going out of town and you want to board your little doggies or your fur babies. Well, there's information on there. You want to live abroad and you need to know what documentations you need. There's information on there about that. If you're looking to gain custody of a child, there's information on there. So it's almost like a concierge service that's made available to you. All right. Oh, let me go back. So these are some of the services that are made available to our agencies. Our supervisory referrals, group counseling, and critical incident stress debriefing. Supervisory referrals, if a supervisor feels like something's not quite right with John or with Susan, you're crying a lot, or they're getting to work late a lot, or they're not showing up at work at all, they can document that and fill out a supervisory referral and have you go and see our EAP, utilize our EAP. Now, you have 5 days to contact Behavioral Health Systems, Inc. to set your appointments up. If you do not set your appointments up, Behavioral Health Systems will contact your supervisor who completed the form and say, hey, so-and-so did not show up or did not set up their appointments, and that's it. It will be at the discretion of your supervisor, your manager, whoever completed the supervisory referral, on what to do next. If there are any disciplinary issues that will come after that, that's up to them. Group grief counseling. If an employee, a long-term employee dies or an employee dies of just a freak accident. There was one where a young lady died in a car accident. And we get a few calls, not quite a few, but a few calls requesting group grief counseling. We've also had calls where employees have committed suicide. And unfortunately, it happens. I think last year we had 2. Unfortunately, it happens, but group grief counseling is available. Once we receive the call, we have someone on site within a couple of hours, and that therapist is there for the duration of however long they need it. All right? And they can do the group grief counseling and individual counseling. Of course, this does not go towards your 3 free counseling sessions. Critical incident stress debriefing, if there's like an active shooter or violence, employee violence, it happens. Employees start fighting. Get a few from DOC from time to time. I can only imagine the stress level there. But critical incident stress debriefing, we can have counselors available. If there's like an active shooter, a couple of years ago, there was a shooting down at the courthouse where someone was killed. Well, our office was called, and our office also, because of the close proximity, actually had to do critical incident stress debriefing. So these are things for the agency. So remember, you can do self-referral with the EAP. You can just call us. We'll get you linked up. Or it can be a supervisory referral. Your supervisor can have concerns about you, genuine concerns, write it up, and then you can access our EAP. And remember, we have quarterly trainings. Those trainings are free. You get free continuing education hours or free contact hours, especially our nurses, social workers, and accountants. And we also have which is new, we did our inaugural one. I'm coming to you. We did our inaugural one last year, our EAP Behavioral Health Conference, and it is free. And it's this year it's Wednesday, October 7th, from 8 to 4. And more information will be going out. Let me go ahead and take your question, and then I'll wrap it.
I'm curious, you mentioned EAP possibly providing services to children that are college age. What about school age?
Yes, absolutely. If they're a dependent child, they can access this service. Now, someone recently asked me, how old does the child have to be? Well, they can be at best 14 years old to pick up the phone and just call themselves. Otherwise, of course, we would expect the parent to make that phone call. Yes, ma'am.
My question is, I know we have the three visits,
Mhm.
etc. You mentioned that if, I guess we have a child or family member, they can go. Does that tie into our three?
No.
Or each person has their own?
No, as long as they're your dependent family member, they'll have their own 3 free sessions. Any other questions? All right. Well, this is how you access the EAP. You can either call my office, which that number is listed at the bottom of this little brochure that I gave you. You can call Behavioral Health System, which is our contracted agency. You can ask to speak to your EAP care coordinator. And you'll have to provide your agency and job class code. If you do not have your job class code, we'll be more than happy to get that information for you. Most of the time, our employees, they don't have it, which is fine. We have a full list. No problem. Also, your dependents that's going to access, they need to know that information as well. And of course, as a reminder, we have out-of-state services. BHS's or Behavioral Health Systems business hours are from 7 until 5:30, but you can always call their office throughout the day. All right. Well, that sums it up for me. Thank y'all so much.
Thank you.